Thank you. Good evening, everyone. My name is Barton, and today we will be learning the signs of cardiac arrest and how to accurately treat it through the 5 steps of the cardiac chain of survival. Heart disease is the leading cause of death in the United States. By recognizing the signs and symptoms of cardiac arrest, being aware of the cardiac chain of survival, and how to accurately perform CPR, America can lower the chances of death due to cardiac arrest. According to the American Heart Association, in 2016, more than 350,000 people suffered from cardiac arrest. Some signs of cardiac arrest include a victim suddenly collapses, a victim is unresponsive, or a victim has no pulse. A heart attack is when the heart muscle experiences a lack of oxygenated blood. This is different from cardiac arrest because cardiac arrest is when the heart physically stops beating or beats irregularly or too weakly. A heart attack may cause cardiac arrest, but they are not the same thing. It has been scientifically proven that there are increased chances of survival if cardiac catheterization is performed within 90 minutes of onset signs. So the 5 steps of the cardiac chain of survival include the first, recognition of cardiac arrest and activation of EMS. The second, early CPR, which I'll demonstrate later in this presentation. The third, early defibrillation using an AED. The fourth, advanced life support, which would mean EMS arriving to the scene. And the fifth, integrated post-cardiac arrest care, so care with a hospital and with a doctor. The key to survival is delivery of high-quality CPR. So, to perform CPR, the first step is to do a primary assessment. In this case, I have a demonstration of a victim who I have walked up on who is apparently unresponsive. So, the first step in a primary assessment is to size up the scene. We are surveying the scene for any dangerous or harmful scenarios such as chemical spills, if the victim is in water, or if the victim is severely bleeding. If the victim is severely bleeding, we would treat that first. The second step to a primary assessment is to use the appropriate personal protection equipment. Today, I'm using gloves. So, when forming a primary assessment, you always need to have your gloves and doing any medical assistant for a victim. The next step is to check for responsiveness. So checking for responsiveness could look something like this. Are you okay? If the victim does not respond, then you know that they're in trouble. Then when you know they're in trouble, you would activate the EAP, which is an emergency action plan, which includes summoning EMS. After you summon EMS, that is when you would open the airway by using the head tilt chin lift technique and check for the pulse of the victim for at least 5 seconds, but no more than 10 seconds on the carotid artery. So, something like this. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000, 7 1,000, 8 1,000, 9 1,000, 10 1,000. If you then determine that the victim has no pulse, then you know that the victim is going through cardiac arrest. So the first step, or the next step in cardiac arrest is to give 30 chest compressions. So for these chest compressions, you want to be sure that I use my non-dominant hand, my bottom hand, and my dominant hand is the top hand. I keep my non-dominant hand, the bottom hand, flat, and make sure that I put the heel in the center of the victim's chest in between the nipple, on the nipple line. And I keep my other hand just on top. Whenever you're giving compressions, you want to be sure to be on top of the victim rather than to the side of the victim, because you want to be sure that the compressions are given in the direct center of the chest. Something you also want to be sure to remember is to not bend your elbows. So your elbows should never be like this. For accurate compressions, you want to keep your elbows locked. Another thing to keep in mind is So you would give 30 chest compressions. So, yes, you would want to do it to the beat of 100 beats per minute. So 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 9, 30. The next step in CPR is to give 2 good ventilations. So I have my pocket mask because I am a certified lifer. So the way the pocket mask goes onto the mouth, the nose, it's labeled with an arrow. You put the tip over the nose and you seal the mask on the mouth. The way you seal the mask is you make your hands into 2 C's, one on the top, one on the bottom, and you seal the mask over the mouth. And then again, you would open the airway by the head tilt, chin lift technique and give 2 good breaths. And then after you give the 2 good breaths, you would go back into the 30 compressions, the 2 ventilations. That cycle is continued until either you are too tired to continue, EMS personnel arrives and is ready to take over, an AED arrives and is ready to be used, there is an obvious sign of life, or the scene becomes unsafe. You never want to perform a skill like cardiac or CPR whenever the scene is unsafe. So, in conclusion, we learned how to perform CPR and we learned the 5 stages of cardiac survival. So, thank you very much and have a good evening. Can we talk about how it got way better?